Good morning, everyone. Thank you for joining us today to discuss the CMS Internet-Only Manuals. My name is Karen Curtis, and I'm Provider Outreach and Education Specialist here at WPS. Today, I am joined by my friend and coworker, Bailey Lawson. Bailey will be monitoring the chat for questions. She's also going to be providing you with some additional information and links as we go through the webinar. I do have a couple of housekeeping things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and you would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. Bailey's going to add a link into the chat so that if you need to get there quickly, you can do that. You will also find that this is where we have a list of all of our upcoming events. We do also publish our slide presentations with those events where you can find links. Now, our training center also contains a web page for our encore presentations. Videos are available for up to 90 days. They can be watched on our web page without you having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we want to make sure that you are able to receive the education that interests you. Now, each encore is posted with a link that will allow you to download a copy of the presentation. So even if you didn't join the webinar live, you can still get copies of the presentation if you would like. Today's presentation is being recorded, and if there are no technical issues, then it will be posted out to our website within the next few days. Now, later in the presentation, there will be a question and answer session if time permits. Since we're kind of doing internet-only manuals, it'd probably be, if there's topics that you are looking for, we can try searching for those. I did get some topics in the registration process, so I will be going over those. But if you have anything that you've been looking for that you can't find, please go ahead and put that in the chat and we'll see if we can get you some help with that. Now, our goal is to provide you with an excellent customer experience. We want to know how we're doing. So later in the presentation, you will be given the opportunity to provide feedback. This is your chance to let us know what we're doing right. Let us know if you feel that there's areas where we can improve. It also allows you to give us input on what types of education you would like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Here is a copy of our disclaimer. I do need to let you know that CMS does prohibit recording of this webinar for profit-making purposes. We are recording the event, and it will be posted to our Encore Presentations webpage and our YouTube channel. So it will be available in case you think there's something you missed or if there's information that you'd like to share. Here's a look at today's agenda. I will talk a little bit about the CMS manuals and some that I consider frequently used before we move on to the live navigation. So the CMS Internet-Only Manuals are a collection of policy and operational guideline documents published by the Centers for Medicare and Medicaid Services. These manuals provide detailed day-to-day operations instructions, policies, and procedures for both Medicare and Medicaid programs. These manuals are actually replicas of the official CMS record. They serve as a resource to ensure that there's consistent application of CMS regulations across different healthcare settings. Manuals are updated periodically to reflect changes in federal laws, policies, and CMS programs. I don't know how many of you look at change requests, but at times you will see that there's a business requirement that does mention that there will be updates made to the Internet-Only Manual. So who is this guidance for? There is a wide range of individuals and companies that can benefit from the information provided in the CMS manuals. Doctors, hospitals, nursing homes, and other medical professionals who need to follow Medicare rules for patient care and reimbursement. Billing and coding specialists who are responsible for submitting claims and ensuring proper Medicare and Medicaid reimbursement are received. Medicare contractors, insurance companies that process claims and oversee compliance and CMS regulations. State survey agencies who conduct inspections to ensure that healthcare providers and facilities comply with federal and state regulations. Legal and compliance officers who ensure that healthcare organizations follow federal healthcare laws and avoid fraud. And even the general public can access the manuals. Now, I don't know how many would want to, but they are available for anyone who wants more information about the program. I've worked in Medicare for 27 years, and there's still some sections where I have to read it a couple times before it actually clicks. Now, there are around 25 manuals on the CMS website, which covers a variety of topics. A general overview of the Medicare program, entitlement, coinsurance, and deductibles can be found in the Medicare General Information Eligibility and Entitlement Manual. The Claims Processing Manual provides instructions on how providers should submit claims for reimbursement. It includes coding, billing requirements, payment methodologies. The Program Integrity Manual outlines policies for preventing fraud, waste, and abuse. This is a screenshot of the IOM webpage, so you can see some of them that are out there. Now, I do want to mention a couple of the manuals that I thought were helpful. And there are a few manuals that kind of lay out the foundation of Medicare. I mentioned the Medicare General Information Eligibility and Entitlement Manual just a minute ago. Here's where you can find general program information, regarding benefits for Part A or home health, Part B Medicare. CMS describes the roles of the MACs and the purpose for the Quality Improvement Organizations, or QIOs. Some of you may remember they were once referred to as peer review organization, or PROs. In a few webinars, the topics of benefit periods has come up. So in this manual, CMS has a whole section on benefit periods for both hospitals and skilled nursing facilities. You can also find details about physician certification and recertification. The Medicare Benefit Policy Manual, this takes the different covered benefits and it breaks them down into different chapters. So you can find information on coverage for inpatient and outpatient services provided in a variety of different healthcare settings. For example, there's a whole chapter on lifetime reserve days that will explain it, when you could use it, when the beneficiary chooses not to use them. The State Operations Manual covers program background and responsibilities. So there you can find chapters on certification that reviews the requirements for initial certifications, and another on compliant procedures. Now, services must be reasonable and medically necessary is probably a phrase that you've heard too many times to count. The Medicare National Coverage Determination Manual outlines the circumstances under which Medicare will cover specific medical services, procedures, or devices on a nationwide basis. This helps ensure consistent coverage decisions across all of the MACs. Now, there are, we're talking national coverage determination. So MACs can develop local coverage determination, which would be specific to the MAC, but the NCDs is for everybody to follow. The Medicare Program Integrity Manual provides guidance and instructions to Medicare contractors on how to prevent fraud, waste, and abuse within the Medicare program. You can find an overview of the medical review and the program integrity programs. I'm sure a lot of you have probably heard of the CERT program, which stands for Comprehensive Error Rate Testing. This program collects random samples of Medicare fee-for-service claims. They review them, and then they determine if they were paid or denied properly under Medicare guidelines. Their goal is to reduce errors and improve billing practices. So you may have been part of webinars where people talk about the CERT errors, and they talk about how to avoid those errors, things like that. The Medicare Claims Processing Manual is one that I have referenced quite often in my Medicare career. Here you can find detailed instructions and guidelines on processes on submitting Medicare claims. When I started as a customer service representative, our training consisted of reading paper copies of this manual. We would actually go through the manuals, we would highlight sections that we thought were important, we would tab pages that we had to reference frequently, and when we would get calls from back in that time, we took beneficiary and provider calls, but when we took provider calls, we would pull out these paper manuals and we would find the section and we would refer providers to that section. This manual will take Medicare services and break them down into how to submit a Part A claim versus a Part B claim. You can find which place of service to put on your claim. Part A providers can find revenue codes and type of bills. There's even separate chapters that will take you through filling out a UBO4 and a CMS 1500 claim for. There really is a ton of information that can be found there. The Medicare Secondary Payer Manual also has a lot of information. MSP denials continue to be on our top 5 across all jurisdictions. This is also where you can find model admissions questions for beneficiaries. So I know you've probably heard about this in a couple webinars. I know I personally have talked about them where CMS has provided a list of questions to ask at the time patients are admitted or when they receive services so that you can determine who should be paying primary. Now here I've added a screenshot so that I can show you the pathway to find the internet-only manuals. You're going to start at cms.gov, then you're going to click on Medicare, you'll go to Regulations and Guidance, and then you'll go to the internet or to the manual section. So there are a couple things I would like to show you that I received topics on during the registration process. We are going to go through a couple of the manuals just so I can kind of show you what information is out there. But like I said, if there's anything that you've been looking for, please add that in the chat and we will try to find that for you. So let me go out to... I use this one so much, I have created a shortcut to Publications 100-4, but we are going to go to the home page. Now, before we get into the internet-only manuals, they do still have some paper-based manuals out here that they are in the process of converting. So they have the Provider Reimbursement Manual Part 1 and Part 2, and they also have the State Medicaid Manual. Here they also have future updates to the IOM. So this is something I did want to show you. It does list it has the change request, what publication is going to be updated. It gives you the subject and the implementation date. It does say specific sections in the manual will be updated to reflect these changes on the implementation date. So just when I scroll down here, there was one that is actually going to be updated today. This is some changes that are being made to the NCDs. So if I click on this, it'll actually take me to the change request. I recently did a webinar on colorectal cancer, and it was ending some diagnosis codes and making other diagnosis codes effective. The manuals had not been updated, so they should be updated today to reflect this information. So I just wanted to take you out here and show you what this would look like for updates that are going to be made. So now if we go into the Internet-Only Manuals. One thing I am going to point out, I had gotten asked a question about ESRD. I was kind of looking through here and I noticed that there was publication 100-13 and then it went to 100-15. So when I went out and I was looking like what was publication 100-14, that's actually an ESRD manual. I don't know if they're making changes to it, but I currently could not find it anywhere. Even the Health and Human Services, the hhs.gov website references it, but when I click on the link to try to find it, it tells me the page can't be found. So I just wanted to bring that up because I don't know if they'll be putting that out there, and maybe that's something that you should just watch for, but I did find some other information on ESRD, so I will go over that later. So I wanted to start out, the introduction just kind of talks about the Medicare manuals. Here you can see it lists publication 100-14, but I'm not able to find it anywhere. So this is just kind of an introduction, talks about the manuals, what they're used for, things like that. If we go to 100-1, now this is going to be Medicare General Information Eligibility and Entitlement. So you can see it does kind of break things down. We talked about the physician certification and recertification of services. So if that's something that you need more information on, this is where you would be able to find that. I did want to point out in Chapter 3 where it talks about deductibles, coinsurance amounts. Benefit periods are also a place where there can be some confusion, and we have had questions come up during webinars about benefit periods and understanding them. So this is actually covered in the manual. If I scroll down here, it took me to the coinsurance and deductible part, so I'll have to scroll just a little bit here. Here you can see in red, whenever they make recent updates, they will put those in red so you know what the new information is. So they have added the 2025 amounts out here. But here it goes into benefit periods or spell it illness. It gives you some information about it, tells you what a patient's eligible for. It talks about starting a benefit period, ending a benefit period, the definition of a hospital or a SNF. So here's somewhere that you can go if you are having a hard time with benefit periods, and hopefully this can provide a little bit better understanding of those. So I just wanted to let everybody know that that information is out there, and maybe it could help those who are having a hard time understanding it. Publication 100-2 for the Medicare Benefit Policy Manual. here's where we talked about lifetime reserve days. So it literally has a whole chapter just on lifetime reserve days. Talks about when beneficiaries elect not to use them. And I thought it also had, sorry, I'm scanning a little too fast. Long-term care, hospitals. So just a whole chapter on that. Now I do want to take you down. Here is another chapter on ESRD. Now, remember, this is like coverage, so this is going to be more general and not get into in-depth billing detail, but it will talk about coverage for ESRD. Rural health clinic, this is another topic that comes up a lot. Again, we're talking overall coverage. This is not getting into billing specifics in this particular manual. I did want to bring up Chapter 15. I've been doing a series of webinars on preventative services, and it does refer me to Chapter 15 a lot. So sorry, I got down here. There are some physician services, talks about coverage for those. That might be something that's of interest to people. I wanted to go down here. Sorry for the scrolling. You can see it's going through a lot of different, so you can pick out specific services if that's something that you're interested in. I did want to point out here, I get asked a lot in my preventive services webinars if other healthcare providers can provide the services other than just the doctor. So here I'm just going to click on physician's assistant, but it does talk about qualifications. It says that they can provide services for if they're legally authorized to do it. Talks about incident 2, medical record documentation for Part B services. So that's something I just wanted to show you guys because that is a question that I get asked a lot. I also wanted to take you to, again, sorry for the scrolling. I just don't know what other way to go through this with you guys. 280 for preventative services. This is where I get referred to a lot when I'm looking at the Medicare claims processing manual. It does go through the different preventative services. Here it kind of breaks down if what it's talking about is for a Part B claim. So you'll see AB MAC Part B, so that means a CMS 1500, or a AB MAC Part A, so that's going to refer to like the UBO 4. If there are different billing instructions for rural health clinics and FQHCs, the manual is going to break those out. So you can see that it gives special billing instructions. It tells you what type of bill it should be on. It gives you the revenue codes. So it really does provide a lot of detailed information. There's another section I wanted to show you guys. I just did a webinar on colorectal cancer screening. So there's a lot of information in here that talks about coverage for that. Another one that gets brought up a lot, general exclusions from coverage. So this webinar, or I'm sorry, this manual gives you some general exclusions, services that are not medically reasonable and necessary. So there's another one that you may want to refer to find out if the service is even going to be covered. There's also this little link up here if you ever just want to get back to the main page. The NCD manual, it is broken down by NCD numbers, so this might be a little bit more difficult to navigate if you don't know what the NCD is. I will say personally that I find the Medicare coverage database is a little more user-friendly. That is something else that you can find on the CMS website. But here, I'll just kind of show you that it is broken down by what NCD is assigned to that service. So it's just, I just find it a little bit more difficult to know what section I'm supposed to look at. They're all labeled Chapter 1, and it's just broken into 4 different parts. So that's kind of just a personal preference. If you know what the NCD is, you could probably come out here pretty quickly. You just have to have that information before you got here. Publication 100-4, this is the one that I said I used a lot, and this was one that we used a lot throughout my Medicare career. Now, the general information or the general billing requirements, there's not really a lot of specific information where I could see you actually referencing it. The only thing that I will say that you can find in this section or in this chapter is the timely filing rules and exceptions. That is one thing that we do get asked questions on. So that is out in this section if you're interested in that. We were talking about the pre-submitted question I got about ESRD. They put consolidated billing. I don't know if that was exactly what they were looking for, but I did find in this Chapter 8 outpatient ESRD, here in Section 10, there's actually a link that will take you to the ESRD PPS consolidated billing webpage. So again, that was put in parentheses. I don't know if that's exactly what you were looking for, but I just wanted to show you that they do have a whole web page dedicated to ESRD consolidated billing. So maybe that would be something that would be helpful to you. Here's another chapter where you can find rural health clinics and federally qualified health centers. So that would provide some information. We get a lot of questions regarding billing for these facilities. So here's another area that you can look at. Preventative services and screening. This is one that I have been referencing a lot from my series. This does I'm sorry, let me go back up. I want to go to the annual wellness visit. This was one that we also get a lot of questions on the annual wellness visit, what services are covered, things like that. So I'm sorry, let me get to that real quick. So here you can see it gives you like covered HCPC codes. Again, breaks it down. If you are billing for a Part B service on the CMS 1500, it tells you the type of service code that should be used on the claim, gives you HCPC codes, and then it does give you another manual reference if you need more information. Here's where it goes over the Part A billing, gives you what type of bills that these services can be billed on. Talks about payment. Again, separates out rural health clinics and federally qualified health centers. Talks about coinsurance and deductible. It breaks down, and there are a lot of sections that do this. It will tell you if there's common working file edits that could deny your claims. We got remittance advice codes. And they got advanced care planning and social determinants of health. These were services that got added more recently that a lot of people had questions on. So it does break it down here and give you more information on how to bill for those separately. For the Medicare Secondary Payer Manual, we talked about those admission questions. Those are found in Chapter 3. Now, CMS doesn't require you to use these questions for beneficiaries at the time they're admitted or services are provided. But the way I see it is they already did all the work for you. So it does cover each of the different insurance companies. It gives you questions that you can just give to the beneficiary. So you could, basically copy and paste this onto something and have them fill it out. So I just wanted to make it sure everybody knew those were out there. Also, they have a whole chapter on Medicare managed care. A whole manual on Medicare managed care. WPS does not process Medicare Advantage claims, but we do get asked a lot of questions on it. So there is a whole manual out there that could help you with that. There's also another manual on Medicare prescription drug benefits, so Medicare Part D. If you have questions on that, that manual could be helpful to you. I also wanted to show you, they do have the Medicaid ones out here too. So if you are a facility that also bills claims to Medicaid, you could find information out here that could help you with that. Now, I do want to ask Bailey while we're out here, has there been anything that has come through in the chat?
We have one thing that has come through. It's about the NCD manual. It says the NCD manual does not have the Excels for those NCDs. Where can we access those?
The XLs? I'm sorry, is that what you said, Bailey?
It is Excels, yeah.
Okay, I guess
it was when you were speaking at the very beginning of your PowerPoint. That's when it came in. So I was trying to look it up for you, but.
Okay. I don't know if this would help, a crosswalk. I guess I'm not, for the Excels, I'm guessing you may be talking about a spreadsheet. I did bring up the Medicare coverage database, and even though this is a webinar on the Internet-Only Manuals, since a question came out about NCDs, I do want to show you where you can find that. If you go to Medicare and go to coverage, there is the Medicare coverage database. And here's where you could put in, I'm just going to put in lipid. And it gives me NCDs. You can kind of narrow it down. So here it would give me an NCD 190.23. So if I went back to the NCD manual, the Internet-Only Manuals, and I wanted to find information on lipid testing, I could then look up 190.23. I would know what section to put it in. I will tell you, I compared these and it is the same information. So if there's a national coverage determination, the information on the database is the exact information that's in the manual. It's just two different places that you can find it. I don't know if that helps the person that put that in the chat, but hopefully that provides some clarification with that.
All right, well, other than that, Karen, we've got no other questions.
Okay. Let's go back. Okay, after the close of today's webinar, you are going to receive a thank you for attending email. And here's where you're going to find your proof of attendance and contact hours for continuing education units. This email also contains a link which will give you an opportunity to provide feedback on today's webinar. Now, if you don't get this email, then please check your spam or your junk folder. You'll also need to add messenger@webex.com to your safe sender list. If you joined only by phone, you will not receive this email. So in that case, please send an email to the education mailbox, include your name and the phone number that you use to dial in. That way we can send you a certificate that if you need one for continuing education units. Now, if you do think of something, maybe you're having problems finding something and you just want to reach out to us and ask us if we can help you with that, you have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line. That way staff knows that your question is related to this webinar and they'll send it directly to me. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Bailey add a link in the chat. And your feedback really does mean a lot to us. We review what you have to say and we do our best to make the changes that you ask for. Like I said, this is also an opportunity for you to let us know what topics you want us to provide education on in the future. So if you have something specific, please let us know. Also, if you have ideas that you think would improve the way you receive your education, be sure to tell us that. We would love to hear what you think. The redirect does look like what you see right here. We're showing you this because we have no control over how it appears, and we just want you to know it's not spam or it's nothing malicious. That does bring us to the end of today's presentation, so you are going to get a little time back in your day. On behalf of myself, Bailey, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.